Hey everyone, this is Mel, and for my project, I'm going to be explaining the Affordable Care Act as it relates to healthcare for patients, including the pros and cons. So I'm just going to start off by giving a brief history of the Affordable Care Act. As many of you can recall, this was dubbed as Obamacare back in the 2010s in the political media discourse. So it's important to note that the Affordable Care Act is considered the largest overhaul of the healthcare system since Lyndon B. Johnson's 1965 bill, which established Medicare and Medicaid. Previous administrations were conservative. As you remember, George Bush was president before this administration, and ideas of like affordable healthcare or universal healthcare system are just not popular on that political landscape. And so the Affordable Care Act kind of brought like this point of view of like a Dutch model of healthcare, something like that, like maybe that are more common in like a socialist country. And so this was kind of a step towards that direction in terms of like left-leaning healthcare policies and a step towards universal healthcare. So now I'm going to delve into how the ACA actually helped Americans. So the main purpose of the ACA was the expansion of health insurance coverage, and that was by expanding Medicaid incomes up to 138% or 1.38 times the poverty level. So before the ACA, so before 2010, about 14 to 16% of Americans were uninsured, and by 2023, that number has decreased to 7.7%, which was ultimately the goal of the ACA, was to expand the amount of Americans that were insured with health insurance. One reason the ACA was a big deal and why I mentioned the fact that it ties into the poverty level is because the ACA was to solve what we call like the benefits cliff in health insurance. So there were people that did not make a lot of money, but they made more than what the poverty level was at the time. So because they weren't at the poverty level, they didn't qualify for Medicaid. But their actual job, their income, didn't really pay them enough to pay for private health insurance. As you all know, that's very, very, very expensive. So they were in this weird limbo in terms of what health insurance options they had for them. I don't know if anyone remembers this, but at this time, I remember all the time we would hear on TV was the idea of like pre-existing health conditions, and this would be brought up every single time the Affordable Care Act was on TV or anytime a political talking head or commentator wanted to talk about that. They would always talk about these pre-existing health conditions. So that could mean a lot of things. Could mean a pre-existing health condition. That could mean, asthma, even type 1 diabetes, so things that you can't even really control or help. And this really affected a lot of Americans because certain insurances would reject them on the basis of a pre-existing health condition, and that obviously isn't fair, and it makes healthcare less accessible to them for something that they can't control. And so people would be like afraid to even switch jobs at the time because they knew that the new jobs insurance might not accept them because of the pre-existing health condition. So it created these huge barriers and was basically like a way of like discriminating against people. But with the Affordable Care Act, that kind of overruled it, and now people with pre-existing health conditions were able to qualify for health insurance and were protected. So basically, their right to health insurance was protected because of the ACA, and that's probably one of the best qualities of the Affordable Care Act if I had to choose one. And another way the Affordable Care Act helped patients was it eliminated the idea of a cap on the amount of money that you could spend from your insurance on your healthcare. So before that, there were a lot of insurance companies that just would like, there was like a limit to how much you could spend on your healthcare. Obviously, that's not really conducive to proper care because you can imagine for these people, I mean, they have to keep going back for chemo or keep going back for dialysis, and they can't control the fact that the treatment plan has not ended. So to cap somebody on, you know, when their insurance should stop paying for the treatment that they have to have is basically like inhumane and almost a death sentence for a lot of people. And so that's another component that's positive for the Affordable Care Act was the stopping of this capping on people's medical expenses. And aside from preventing the capping of the quality of care, the Affordable Care Act also created these standards in which preventative care was a part of the health insurance. So it was like built in that way that would lead to a higher quality of care, as we know that preventative health care is even more effective probably than trying to treat something. And here is a table that I pulled from the ksf.org that explains the differences in how health insurance changed between the normal market insurance and what happened when the Affordable Care Act was instated. And as you can see in this graph, an overall trend of more and more patients enrolling in the Affordable Care Act and being able to take advantage of insurance. And then here you can see on this left table, like where you would fall in terms of your income level related to the type of plan that you'd be able to have with the Affordable Care Act. I know I was previously singing the praises of the Affordable Care Act, but there were some drawbacks. Namely, the biggest complaint of the Affordable Care Act was that it made insurance more expensive. So you're probably thinking, well, how can it be more expensive if it's called the Affordable Care Act? So previously, a lot of insurance companies would offer like kind of bare bones coverage, and they didn't have the standards that I mentioned were implemented, um, before the Affordable Care Act, and so it costed less technically, like on the short end. But of course, you might need those benefits later and then you didn't have them. But it did cost less depending on the insurance that you did have. And so when the Affordable Care Act came along, this kind of overhauled that and then implemented these standards of care, but that made it cost higher overall. So that you see a lot of people that enrolled in the Affordable Care Act saying that actually they have higher premiums, and now that they're enrolled. So maybe their health insurance was better, but that still puts a lot of financial distress on American patients. And as we know from the social determinants of health, being financially stressed is not good for your health long term either. And these higher premiums and not being able to actually lower the cost of healthcare is probably the actual biggest strain on patients and patient care. And then, of course, because this is a government funded Affordable Care Act, it did raise taxes, which, of course, depending on your political views, I know that that is an issue for a lot of people. And it did penalize uninsured Americans and also for people who were small business owners. It's put a big strain on them because you had to offer some form of insurance for your full-time employees. So that kind of changed the way hiring practices would work. And that's where we see people only giving employees, maybe like 20, 30 hours a week just to avoid having to pay for their insurance and not wanting to cover insurance for employees or not expand their business. And in conclusion, I'm just going to tie this up by saying that the ACA was really a start to having a more accessible healthcare in the United States. We're not quite on the level of other countries where we have just great high quality healthcare and it's all taken care of by taxes on a sliding scale, but it did offer some advocacy for Americans that were struggling financially and were in that benefits cliff that I talked about earlier. And it also helped people who were suffering with these pre-existing conditions or were struggling to pay for like finalizing their treatments because they were getting capped on their insurance. But unfortunately, because we changed the standards in healthcare, it did lead to some financial strain for some patients. So I do acknowledge that. And that's pretty much all I have to say, but I hope this was informative for you and that you took a lot out of this.